Good day everyone, I'm Karen Tan. Today I'll be going to discuss about cor pulmonale o ang tinatawag nating pulmonary heart disease. For the introduction, cor pulmonale is made up of two words. Cor, which is Latin for heart, and pulmonale is Latin for lung. Cor pulmonale is generally relationship between the heart and the lung. Nangyayari ito kapag ang isang lung disease ay nagiging dahilan para lumaki at mag-malfunction ang right side ng ating puso. So basically, we have four chambers sa loob ng ating puso. The right atrium, the right ventricle, and the left atrium and the left ventricle. Ang atrium ang tumatanggap ng dugo mula sa iba't ibang parte ng katawan. At ang ventricles naman ang nag-i-squeeze out ng dugo palabas ng puso. It is also known as right-sided heart failure because it occurs within the right ventricle of the heart. So for the definition, cor pulmonale is a condition that causes the right side of the heart to fail. Long-term high blood pressure in the arteries of the lung and right ventricle of the heart can lead to cor pulmonale. So, for the prevalence, cor pulmonale is estimated to account for 6 to 7% of all types of adult heart disease in the United States. Next, the incidence of cor pulmonale is wildly variant among countries. It depends on air pollution, the prevalence of cigarette smoking, and other risk factors for various lung diseases. For the pathophysiology of cor pulmonale, the etiology is the chronic obstructive pulmonary disease or the COPD. In chronic obstructive pulmonary disease, impaired lung function that can lead to inadequate oxygen exchange, causing respiratory acidosis and hypercapnia. The body responds to this by inducing pulmonary vasoconstriction and increasing vascular resistance in an attempt to optimize oxygenation. This, however, can contribute to pulmonary hypertension over time, further complicating respiratory function in COPD patients. And also, COPD can lead to hypoxia or low oxygen levels, kung saan pwedeng mag-trigger sa polycythemia, which can increase red blood cell production. Polycythemia can contribute to hyperviscosity or thicker blood, potentially causing pulmonary hypertension and vasoconstriction in the pulmonary vessels, and leading to increased vascular resistance. This cascade of events can further strain the cardiovascular system. It is crucial for individuals with COPD to receive proper medical management and monitoring to address these potential complications. Next is the reduction of the pulmonary vascular bed in COPD. Contribute to increased pulmonary vascular resistance, making it more challenging for blood to flow through the lungs. This can lead to complications such as right ventricular hypertrophy and, in severe cases, right-sided heart failure or cor pulmonale. For the clinical manifestation of cor pulmonale, we have jugular venous pressure, edema, hepatomegaly o ang paglaki ng atay, shortness of breath, and fatigue. So, for the laboratory and diagnostic examination, first is the echocardiogram. It shows evidence and increased pressure in the pulmonary artery and right ventricles. Next is the right heart catheterization and ECG to monitor the heart's activity. And also, we have medical management. First is the supplemental oxygen, arterial blood gas analysis, and the pulse oximetry. For the nursing management, first, eat healthy foods, avoid smoking, maintain a healthy weight, instruct the patient to schedule frequent rest periods and to perform his breathing exercises regularly. Then, assess the patient's vital signs and characteristics of heartbeat. Then, assess breath sounds via auscultation. For the prognosis of cor pulmonale, first, pulmonary heart failure is a common complication and a major cause of death in obstructive pulmonary diseases. First, the overall 5-year survival rate for cor pulmonale complicating COPD is approximately 50%. And prognosis also appears to be significantly improved by smoking cessation and correct use of long-term oxygen therapy.